Welcome to the Equine Vet Connect podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. Welcome back to the Equine Vet Connect podcast here at Countryside Equine Hospital. I'm Dan Carter. We're here in the studio, old treatment room 1. Got Dr. Zoe back with me today. She's with me. We're going to be talking about biologics and joints, one in particular, good old ProStride.
Yeah.
We're going to be taking that deep dive into it.
Picking up where we left off. This is now episode 3 for joints.
3 for joints. If you haven't heard the other ones, I'd really suggest go back, listen to the one on joint anatomy, joint physiology, controlling pain in joints. Go back and listen to
way earlier within the podcast series.
Scroll back.
And then we did a second episode on joints where we kind of went over, we did another little brief overview of joints, and then we kind of dove into all the biologics, what they were, like IRAP, PRP, ProStride, Renovo. Kind of did a little overview of all of them. And now this is episode 3. We're going to talk in depth about ProStride because it deserves a nice in-depth overview. So
I'm Zoe, it's kind of cool because I was around when biologics were first hitting the scene. And so I kind of over-nerded on this. I absolutely love biologics. They've been pretty mainstream since you've been out in practice. I think ProStride's been out since you've been in practice, right?
Yes. Yeah.
I remember when it came out because we were all PRPing and we were IRAPing, and then ProStride came out, and we're like, whoa, this is cool, right? This is cool.
Yeah.
So we're going to get into biologics. I'm probably going to get a little excited today talking about ProStride. I'm going to get a little excited about.
I'd say ProStride is one of the things that we use most commonly around here in this building. Is if a horse is getting a biologic in a joint, it's going to be ProStride or Renovo.
Yes. So real quick, we're talking about biologics. Like I said, if you get a chance, go back and listen to those other podcasts. So you'll have a better understanding today. But just real quick, in a nutshell, the body produces interleukin-1. Interleukin-1 is a bad compound. It binds to cells and it releases prostaglandin, MMPs, collagenases, all which are bad for the joint. We got our drawing
here.
IRAP basically blocks the binding of that interleukin-1, stops the production of the bad stuff. So it's really good. Then we have the PRP component that we talked about. PRP is high in growth factors. These are anabolic cytokines, meaning they help restore the joint, help rebuild the joint, and help the joint to heal. And then we talk about alpha-2 macroglobulins. They are like the Pac-Man of the joint. They actually come in, find these MMPs, scoop them up like Pac-Man, get them out of the joint, get them rid of them, get rid of that bad stuff. And so those are the 3 things that we're going to focus on. We're talking about ProStride today. All right, we're going to talk about getting rid of some things. We're talking about blocking some things, and we're talking about healing some things. So, I think we talked about this last episode. We talked about IRAP. That was the OG. That was the original, right?
IRAP walked so ProStride could run.
Ooh, well said. Well said. So if you think about it, heroes stand on the shoulders of giants. We're going to call IRAP the giant, right? And ProStride kind of stands on the shoulders of that. So, and like we said before, we don't get a kickback on any of this stuff, so don't think we're out here plugging a product for anybody because we don't.
No, if we talk about it, it's because we believe like in it and we use it every day.
Absolutely.
Or we would like to use it every day.
So the only kickback we really want is if Duncan wants to start sending coffee over for this podcast. That would
Starbs.
Oh no,
Duncan is too sweet. If Duncan is in front of me, I'll drink it. But Starbs is where it's at. Or actually, no, Jittery Joe's.
Jittery Joe's. Actually, you know what? Jittery Joe's. If you would like to be a sponsor of this podcast, all we're asking, send over a little coffee in the morning, or we can stop by, pick it up.
Mocha Frosty Joe, please.
Hot black and bitter shot in the dark. That's my favorite. So Jerry Joe's, yes,
Yeah,
local
yeah.
company. So, as we can't believe we got off topic on this podcast. So we get into this and we talk about ProStride. What is ProStride?
It is basically IRAP and PRP married together.
Yes. So IRAP's produced by white blood cells. And like used to, we had to cook this, right? It was like a little kitchen. We had to go pull blood from your horse.
And it was not an immediate
No.
situation. We came one day, harvested the blood from your horse, took it back to the clinic, processed it, incubated it, cooked it like a chef, came back, injected it into your horse. Then there was like a whole series. You
Yeah.
do like 4 or 5 injections.
Oh, yeah.
Every week, coming back and injecting the joint with a vial of this yellow liquid, and that was like top-notch science.
That was big stuff. That was huge, right?
Yeah.
I mean, if you had IRAP in your clinic, you had it on your website, you had it on your Facebook page. You're telling the world, like, we have IRAP.
We are the coolest.
Yes. Now, we still have IRAP.
Yeah.
I think we talked about having used it, I think, since 2017. You've done one case with it.
I did one.
We don't really use it because ProStride's
I
replaced
did one
it.
in 2020.
Yeah. Well, COVID, IRAP.
It was a knee that was busted.
And I'll tell you, we talk about we don't use it
was
anymore.
busted.
It was actually a great product. Like, if you really look at it, it was a great product.
It was a great product, but we have better stuff now, which
Yeah.
is amazing. I mean,
Exactly.
it's amazing that we have even better stuff than that.
And we look at that, as we talked about, that IRAP is produced by those white blood cells, and those beads we used to cook it with got the white blood cells to release and express that IRAP. The nerds over at ProStride figured out how to do this at one time, right? They have some proprietary mix of something in there.
I gotta
And does
hand
it
it to
in
the scientists
minutes.
that created those little kits for ProStride.
Yes.
You feel like you're just playing with a toy, like twisting that
Heck
thing,
yeah.
and then all of a sudden you're like creating magic,
Yes.
liquid magic, 2 mils of magic.
2 mils of magic. I like that. 2 mils of magic.
I feel like I'm just like literally a kid playing with a toy kit, and like the big brains that came up,
Yes.
they took all that science and brought it all down to these 2 little twisty kits, and I'm like, do you know how smart you have to be?
100%.
Do you know how smart you have
Yeah.
to be to come up with that?
Like, to sit around and be like, how can we make these white blood cells
They have to make it
release this
idiot
faster?
proof.
Yeah.
They had to not only come up with this amazing answer to what we needed, but then also make it idiot proof.
If you go all the way back, you think about the
They're just
nerds
so smart.
that found the IRAP protein inside the white blood cell. And then they went through, like, Lord knows what kind of,
Chemical reactions.
Chemical
Like,
reactions
they figured out
or-
how to like trigger it.
yeah.
Yeah.
And to get this stuff out, you probably had a lab bigger than our clinic figuring out, oh, look, we just identified this IRAP thing.
Yeah.
Oh, here's how we extract it from the white blood cell.
Yeah.
And then these nerds over at ProStride, they're like, hold on. We're going to allow you to do this in 17 minutes.
I know.
We're going to get you 2 kits, simplify this,
That's what I'm saying.
crank it out in 17 minutes. Good. Yeah, I never thought about that till right now.
Every time I hold that ProStride kit, I think about that. I'm like, how much brain power did it take? Like,
Yes.
I just am like so astounded.
I mean, it really is pretty crazy.
We ran and got one of these little kits. We had to take a small break.
Yeah, it took a small break because, like,
Because I just had to show you this. Like when I'm about to do ProStride on a horse, I'm holding this little kit, this ProStride kit, and I think about, like I feel like a child. I'm holding this little like plastic, and then you have to like twist the little tops on these things,
yeah.
like all the little colors, like. And there's like beads in here and like sand
Yeah,
and
like-
stuff, and I
and
just
that's the
feel
magic.
like a child.
Like, I wish I should have probably gotten my old IRAP kit off my truck that's there for emotional support. Like, you went from these beads to you have this powder. And that powder,
I'm playing with sand, and,
Yeah.
then there's this cool little straw. It goes like.
that is kind of
like,
cool.
I mean, you I'm sorry. I wish we could like show you guys. These are very expensive. Otherwise, we would open it and show you one.
I think we actually have a YouTube video on our site showing about making ProStride.
Yeah,
So
yeah.
go over and check out this YouTube video. And if we don't have a YouTube video making ProStride, we're going to make a YouTube video on making ProStride because it's pretty dang cool.
It's really cool. Like, and it's fun to watch the liquid, the colorful liquid get sucked up the little crazy straw and all the
Yep.
fun. Like you literally feel like a kid when you're making these kits. And I just am amazed every time I use one about the science that went behind this. And then they made it so idiot proof because
Stall
I can
side.
do it. Literally stall
Yeah,
side.
stall
It's just,
side.
it's amazing. I don't know. It's just,
It really is pretty cool.
it's one of those things.
So if we got the kid here, we'll talk. We talk about ProStride. It's really
All the science that went into this, and then they made it look so like easy.
Well, and then
Or
this-
they just made it so easy. I don't know.
and
I'm
the
like,
science
thank you.
that we've learned, like after the kit
That'll make me
came
look
out.
good.
Yeah, and like what we've learned after the kit came out, like we said, ProStride's a combination of IRAP and PRP. Well, then we found out up here. So this is a little kit. The cells end up down here in the bottom. That's where all your red cells end up. Underneath this little white disc, that's where your PRP ends up, your platelet-rich plasma. Up here on top is your platelet-poor plasma. We found out up here in this section, there's a ton of alpha-2 macroglobulin. So we actually figured out, we used to say ProStride was two things in one, right? It was IRAP and PRP. And now we just found out, oh, it's IRAP, PRP, and alpha-2 macroglobulin.
So it's actually all three of them.
It's like a trifecta
together.
of joint healthiness and
Yeah.
magic. And here's the crazy part. So when we were doing IRAP, we would pull a good yield. We were harvesting 20 to 30 mils of serum that had the IRAP protein in there. We now concentrate that same amount of IRAP protein. So we pull the PRP out of this side, we inject it into this side, we twist this little top, it mixes with this proprietary magic powder down here, and then it filters out, and we got
like when I
about,
twist that little thing at the top, I'm like, what am I even doing? I don't even know.
you're mixing,
I know.
okay? You're mixing.
I'm like playing in the sand.
You're like mixing the
I'm
cake, You run this thing back to the centrifuge. Down here, we're going to get 2 to 3 mils. There's as much IRAP in that 2 to 3 mils as there was in the 26 mils of actual IRAP. This
So-
stuff's highly concentrated.
Like when we do ProStride on your horse, we harvest 60 mils of your horse's blood, and then from one kit, we are concentrating all of the goodie
All the goodness.
down into 2 mils approximately.
Right.
2 mils. Which we don't throw everything away. There's
Yeah.
that platelet poor plasma that we'll keep because sometimes we'll mix it back in with the platelet rich
Absolutely.
if you want to get more volume. So we don't
Or if
throw
you
all
want
of
some
it away.
alpha-2 macroglobulins.
Or if you want some of that, or we'll keep it for like eyeball cases sometimes, or wounds, or if we can put it in a uterus,
Yeah, uterus.
we keep it for random stuff. Yeah. So
But yeah, that stuff all boils down. And that's why, if you go back to the IRAP days, you're out there every week for anywhere from 3 to 6 injections. Well, this is a one-time deal. We don't have to come back all the time. This is one
which means
time.
less pokes into the joint.
Yes.
Which means less because I don't care who you are, every time you stick a needle into a joint, you run the risk of infection. I don't care where you are or who you are.
Yep.
It's always a risk. Yep. So the less times we go in, safer. Less chance of a flare, less chance of infection. So this has much more of a leg up because we don't have to come back every week and we're sticking and sticking and sticking.
Well, think about it too. Every time we inject a joint, that's 3 days off. So if we do that for 3 weeks, minimum 3 weeks, that's 9 days in 21. You can't work your horse.
At least.
At least. And then we
Pretty
always
much
say,
when your horse was going through the IRAP,
you're done.
yeah, they
You're
were
just
off
hanging around.
anyways.
Yeah, they were off. And now we're knocking this out like one time. Really cool. We're getting a lot of the good things. We're stopping the inflammation. We're putting those great cytokines in there to help the joint heal. And like I said, I'm one I really like. So most of the time when I'm doing a ProStride injection, I'm grabbing some of that platelet poor plasma because I want those alpha-2 macroglobulins.
And I
want
like it
those.
also for volume distribution as
Yep.
well. Because it is that 2 to 3 mils of gold that we're getting at the bottom is so concentrated. You can stand to dilute it a little bit.
Right.
It's not really diluting it because it's not like we're diluting it with bad stuff. We're diluting it with good stuff. But you can spread it out to,
Well, and
a
that's
little bit.
we do one kid, and it kind of varies. Like,
You don't want to dilute it too much, obviously.
when I'm doing it, like a stifle, it's a big joint.
Yeah.
It gets a full kit.
Yeah.
Now, if I'm doing coffin joints, most of the time I'm going to split that kit. I'm going to split that in two. If I'm doing fetlocks,
You can add a little of the platelet pour into
Right.
it, and because a coffin joint can hold quite a bit.
Yes.
So,
So-
instead of throwing it away, you can.
Yeah, you get some alpha 2s in there. We extend
Might
the
as
kit.
well.
Yeah. So we can treat multiple joints with this kit a lot of times. Now, one of the things, like, I hear some people say, like, oh, I can do like 6 joints with it. Well, at that point, I think you're diluting it too much. Like, I think there is a limit to how many joints you
Yeah,
want
you don't want to dilute it too much because that 2 to 3 mils, you don't.
Again, you've got X amount of this IRAP protein in there. Every time you dilute it, you're reducing how much that goes in. Well, now you dilute it too much, we're going back to our old IRAP days.
Yeah.
Like, now we're going back to, like, we may have to do multiple injections. And it's like, oh, no, let's don't do that.
Yeah.
Let's just get it concentrated and put it in. So, Zoe, like, what are some indications where you're like, hey, I want to reach for ProStride in particular. I want to reach for biologic in particular. What are some of the things that you look at and say, hey, this is what I want to use?
Well, are we talking in a perfect scenario
Let's just,
or real world?
let's just talk about real world. We're just talking
Yeah.
like, hey, I want to reach over and grab this biologic. I'm talking to somebody about a biologic. When do I want to use it?
Well, real world scenarios, you would want to use a biologic, number one, when you have a horse that has metabolic issues.
Yes.
So, one that is overweight, has already been diagnosed with insulin resistance, has not been diagnosed with insulin resistance yet, but you are highly suspicious.
When I think, again, we don't get a plug for this, I think this is where those stall side insulin tests from Wellness
Yeah.
Ready,
Yeah.
I think that's when we get those horses that are overweight, we all have them on our trucks. It takes 15 minutes. Run the test.
Yeah.
If that insulin's up, no steroid for you.
Yeah, I agree. It's laminitis is much easier to prevent than it is to cure. And the last thing I want to do is cause your horse to have a flare of laminitis from something simple like injecting its joints. So therefore, if your horse has a propensity for having insulin resistance, and or if we suspect it might be pre-Cushingoid or already has Cushing's disease, which is another metabolic disorder, we do not want to put unnecessary steroids into your horse's body, because that can cause your horse to become very sick. So therefore, biologics are going to be like, that's your bread and butter right there.
Yep.
If we have to inject joints, if your horse is still performing, if it has Cushing's disease and it is still a performance horse, then yeah, absolutely ProStride. Okay, so got metabolic horses. My younger horses, yeah. Anything in my mind like less than 12 years old, and I'm like, because teens and upper teens, I'm like, sometimes by the time they're getting into their upper teens, they kind of have more than just a mild synovitis. Usually they're getting more into the moderate to severe categories. They've already got like actual arthritic changes, like bony changes to the joint, in which case they're kind of getting into the more later stages of arthritis development, in which case ProStride. Sometimes you need a bigger gun, in which case a steroid is your bigger gun.
Well, and I think you bring up an interesting topic there, and this has been where we've had to change as veterinarians. Y'all have heard me say this before. It's not changing how you think, it's changing how you see. And we've had to go through a fundamental shift that, initially biologics, when the steroid no longer worked, when we had, the steroid was no longer working, we reached over and grabbed a biologic, and then it would work. And it took us finally, because we were so ingrained in that steroid and HA, like it had been around for 30 something years. It's what we knew, we were comfortable with. It's kind of where we lived. And then biologics hit, and it's taken us a shift to say, we grabbed this when nothing else works. Why are we not grabbing it sooner? Like if this works when a steroid doesn't, then why aren't we going straight to a biologic? And that's been a real fundamental shift in how we see things. And I think it's easier for your generation because these things were way more mainstream when you came out. Like people from my era, and like I said, I jumped on the regenerative medicine bandwagon long before most. I thought it was really cool.
Yeah.
But we've really had to, it's taken a fundamental shift in how we see this.
Right. And I mean, no doctor can doubt the fact that steroids are wonderful. They have
Fantastic.
wonderful things about them. They are powerful anti-inflammatory products. However, they can be pretty rough on a joint.
I mean, somewhat, but I think it's more. What I look at is you get a lot of anti-inflammatory benefits from the joint or from a steroid in the joint, but you're not getting those growth factors. You're reducing inflammation, but what are you doing to help heal the joint?
Right.
Yeah, you're reducing the inflammation. You're restoring that joint to normal. But I look at it like a reset. You reset it back to normal, but you didn't improve it. When we get into biologics, we're setting it back to normal with the anti-inflammatory. But then we're also putting in there some things that actually help the joint improve. Steroid doesn't do that.
Yep.
Steroid doesn't improve anything. It makes the joint happier,
Yep.
but it's not going to improve the joint.
I would say another case where I would reach for ProStride first rather than a steroid would be a mild synovitis. Just like a mild case of synovitis. I'm trying to get everything to calm back down. I would reach for ProStride first.
Yeah, because that's one thing I have noticed with the biologics. If that joint's on fire, meaning that joint is angry, the synovium are ticked off, joint capsules ticked off, I don't think the biologic has enough power to get that joint under control.
Yeah, if it is a moderate or severe synovitis, like severe synovitis, I think you need to get in there with the steroid first and just calm everything down.
Yes.
And then maybe follow up in about 30 to 45 days with a biologic.
Absolutely.
To put good stuff back in. But you need to get the fire hose in there first. The steroid.
You get that fire knocked out.
Everybody calm down.
Yep.
And then we say, okay, here's some good stuff.
I agree.
So,
You know, and I think another thing, we've talked about this in other podcasts, is knowing what is going on in that joint to cause that synovitis.
yeah.
And understanding that, because if you've got like collateral ligament injuries, if you have thinning of articular cartilage, if you've got, in big ones, collateral ligament strains, which if you've ever had a sprained ankle, you've had a collateral ligament strain.
Yeah.
That's
They can
where,
be tough too because I just feel like they're hard to reach sometimes. They're hard to, and they're easy. I feel like they're easy to re-tear, honestly.
But with the biologics,
I've had a sprained ankle and I feel like I always sprain the same dang ankle.
But if you think about it, and this is something to think about. We sprain an ankle in our world. What do we do? Here, walk around on it. Here's a boot. Here's some crutches. Take some time off, right? Now that horse does the same thing. Sprains this ankle, gets a collateral ligament tear. What do we do? Like, hey, let's get a biologic in there. Let's
I'm
grab
not going to the
ProStride.
doctor and they're not injecting me with ProStride.
No.
You want to inject some ProStride in my ankle?
I mean, I've often wondered, like, and I think this is the truth. Like, a lot of our horse athletes, I think, are better taken care of than we are.
Oh, 100%.
Because I get a horse with a sprained collateral. It's like, yeah, we're taking some time off. But you know what? You're getting some ProStride. You're getting ProStride in this joint. We're going to help repair that collateral. In our world, they're like, here's the boot.
Yeah.
And that's where I think, oftentimes I think when we get into joints, I think we're light years ahead of human med by far.
I am a little jealous, though, of human medicine's diagnostic capabilities.
I mean, yeah.
They have more they just have more testing and more capabilities of diagnostics.
We have the same ones. It's just a lot more difficult to put a horse in an MRI.
I know, but I feel like it's like the abdomen is still very hard. even the chest is a little bit hard as well. It's kind of just like a black box.
That's what we're talking orthopedics, because it's great. We can image that. I'm an orthopedic guy.
But we need like
What do you mean feet are easy?
we need easier, quicker.
Well, and I
I
think
need more like now.
that's what your ultrasound's for. You can scan that collateral, boom, 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 boom.
No, I need to image the inside of the foot now.
Yeah, that does help. That is where you got to grab that MRI.
That's what I'm saying.
Yeah.
I need the MRI, but like on demand.
I mean, it kind of is on demand in 3 to 5 business days.
Yeah, we gotta anesthetize the horse. We gotta do this. We gotta do. It will get there. We just need it
It'll happen.
faster.
So, there's nothing, going back to when we reach for these biologics, I think understanding, again, what's going on in this joint, looking at the ages, looking at other metabolic processes, that's, and interesting enough, we talk about it with Cushing's horses, reaching for the biologics like ProStride. And I'm kind of get on the fence sometimes if I think ProStride's a great product to use in a Cushing's horse, because
Their immune system is not great.
Their immune
I
system's
think
shot.
about the same thing. That same thought crosses my mind too.
and I think that's when
Has anybody done any research about that?
not that I've seen,
Yeah,
but
because I often wanted the very same thing. I'm like, I don't know.
that's to me when I reach for one of the off-the-shelf products. Like, if I would normally grab ProStride, maybe I start thinking about a Renovo, because we do have some IRAP protein in Renovo.
Yeah,
We do have those same growth factors, but
it has growth factors and proteoglycans and extracellular proteins and stuff in it. It has that.
and what we're getting at there is when your horse has Cushing's, its immune system is suppressed. Even when it's controlled, their immune system is not as good as it should be. And we're not producing growth factors the way we should. We may not be making as much of the IRAP protein. Nobody studied this, but it'd be interesting to know what that effect is. But knowing those things, I get a little concerned. Do I want to use the horse's blood that I know may not produce as many of those growth factors? Do I really want to use that to try to treat it? Or do I want to go grab something that like Renovo, known
Or
quantities?
are we just making assumptions?
That's
I
what
would
we don't know.
love to see some research behind that.
100%.
All right, scientists, get on it.
Yes, nerds, we need to know, does Cushing's play a role in the growth factor production used?
I mean, we're just making assumptions
Yes.
because it is proven that Cushing's horses have impaired immune function.
And if you're listening to this podcast and there's a paper out there that already discusses it that we somehow haven't seen, hey, shoot that over to us. We want to read it, and we will. Yeah, I'd love to know, because I haven't seen it, but then again, it may be published somewhere that I just haven't found it.
Harvesting ProStride from Cushing's horses. I would be very interested.
Yep. So nerds, we need you to jump on that and figure that out. So,
Yeah.
and a couple things when we talk about ProStride, set us up for success. One of the things that I talk about is if we're going to do ProStride, I want to know, has your horse been on NSAIDs? That's your Butte, your Banamine, your Equiox, because we do know that those things can decrease. There was a paper published by Zoe where they did look at NSAIDs, and if it's been like a single dose within the last 24 hours, it doesn't really have an effect. I think it's when we get into the multiple doses tied together. But like, let's say they had
For
a dose of Butte.
for example, your horse gets Equiox or Previcox. Some people call it Previcox. It lives on that every day.
Right. We need to have a washout period.
Yeah.
We need to be off that for a while before we pull that ProStride, because it will decrease the amount of IRAP and the amount of the good growth factors that we can harvest from this. Single dose, not going to hurt anything, but it's one of the horses that are living on these. So, make sure you tell us, like, if we're talking to you, make sure, one, if we're coming out to do a lameness exam or performance exam, make sure they're off of these medications in general. Make sure they're off of the Equiox. Make sure they're off Butte. They're off Banamine. Don't say like, oh yeah, he gets that every day. Equiox is not a supplement. It is a medication.
Yes.
They need to be off of it for, I like 3 to 5 days before I look at them, because it can cover so many things up. But in this scenario, if they're on that Equiox long term and we do harvest ProStride, it's not going to be near as effective,
Yeah, that's important. If the vet is coming out to see your horse for a lameness evaluation, most vets prefer for them to not have any pain medication beforehand. We want to see him as is.
Yeah, we need to know.
We need to know. You're like, oh, but I don't want him to be in pain. We don't either, but we need to know how bad it is. We need to know what, you're like, oh, but it's bad, doc. I'm like, yes, I need to know how bad it is.
Yeah, it helps us because
we need to know the severity.
It kind of points us in a direction we need to be looking.
I don't want to have Equiox or Butte dampening the I need to know how bad.
Yep.
Yeah.
So we come out, we do a sterile prep on the neck, we pull it. We're going to make our little concoction here to our really cool kit.
Pull our 60 mils of blood.
We're going to put that back into the joint. And this is where I talk about I need to set expectations. Okay. If you've ever had your horse injected with steroids, you know this is some magic stuff. It's a very potent anti-inflammatory. I mean, within 5 to 7 days, and we always say 2 weeks from max response, but usually 5 to 7 days, you're like, holy crap, I got a new horse.
Yeah.
And unfortunately, a biologic is not going to work that fast.
More of a slow burn.
Yeah. I'd say it's a 30-day response.
And a lot of people don't like that. And so that's a little bit of, it's funny that you mentioned that because that's a little bit of a hurdle that I run into as well, because not only are biologics more expensive, but people don't like the wait time.
Right.
Because steroids are cheaper and they work faster. To the client's eye, they work faster. But as we know, there's a lot more benefit, to using a biologic. But they do take about a month rather than a week to.
What I like to say is microwave versus crock pot, right?
Yeah.
Microwave versus slow cooking that thing.
That bowl of chili is going to be so much better coming out of the crock pot than heated up in the microwave.
Absolutely.
Yeah.
And so that's something you need to think about, which, kind of says hey, be mindful and start planning. Don't wait till right before the big event and be like, oh, I need to get my horses looked at to see if they need anything before they go. Let's have a plan.
But so often people do not think far ahead. They're like,
right.
Oh, dang.
Yep.
The barrel race is in 2 weeks.
Yep. Capital challenge is in a week. We've got.
And then they come to me panicking.
Yep.
I know. It's not setting anybody up for success.
Yeah. So if we're going to use these biologics, we do have to think ahead, which is just a good thing in general. I try to tell, and most of my trainers, we try to start prepping these horses. If we've got something big, we're starting 6-8 weeks out. We're not waiting till the last minute. But that's been an education process.
Let's back up even further. Kind of what we're training people to try to do anyways is if you have a competition horse that is in regular work, regular year-round competition, or even seasonal competition, having that horse what we call performance evaluated twice a year.
Minimum.
Yep. Every 6 months at the minimum, at least 8 weeks away from a very important, your most important competition. Not within an 8-week window of your most important competition, because if we need to do anything, we need that much time to get our ducks in a row. We don't want 3 weeks before the biggest competition of the year, you're coming to me with a panic and you have a limping horse. Because I'm like, 3 weeks is not enough time.
And that's the other thing is we want to catch these horses. We've talked about this. I work in a lot of show barns, and I don't work on that many limping horses. A lot of what I'm looking at is they're starting to decrease in their ability to perform. Let's say that horse has been winning, but now it's not jumping as smooth as it was. The changes aren't as smooth as they were. That's, fortunately, that's when I get to see a lot of these. Yeah. And so we're flexing, and it's, don't wait till it's limping. If you start to notice a decrease in that performance, because again, that also opens up our ability to use these biologics. And the biologics, the interesting part too is I've had a lot of horses with biologics. It actually lasts longer. We actually get a longer term effect out of them because not only controlling inflammation, but we're actually getting those good cytokines in there, helping things heal. And so I've had some horses that we've pushed 12 to 18 months. So, getting to these horses earlier when they're beginning to have a decrease in performance, that's a whole lot better than waiting until we limping.
Yes.
It opens up more options because, like I said, some of these biologics are fantastic. But like you said earlier, if it's on fire, we're not going to be able to use this.
Yeah. And training people to have that mindset of like, okay, twice a year, even before my horse starts limping, having the vet coming out to just put another set of eyes on my horse, watch him jog out, flex all the joints, just make sure everything's good. Okay, safe, nothing pops up. Okay, great. Keep going on with life. But maybe something is already a little off. Okay, let's go ahead and get a biologic in there before anything even becomes an issue. And you never have downtime hardly, except the 3 days you got off from the injection.
Right.
Boom. And then you never, in an ideal world, you would have the least amount of downtime.
Well, and then too, people don't think like some of these joints, they start bothering them and it kind of creeps on them, right? So it's getting slowly worse and worse and worse. And then horses start picking up bad habits.
They start compensating for
Yes.
things, and because you see your horse every day, you ride your horse every day, and you don't notice those very subtle changes because each day your horse is going to get a little more sore and a little more sore and a little more sore, and he starts compensating here and there, and then that's how you get a lot of soft tissue injuries. Usually because the horse is overcompensating for something else that's hurting.
Well, and a lot of the horses, like a lot of the jumpers I've worked on, is they'll start to get a drift, either a left or right drift. And they'll get this drift, and we'll go in and we'll identify the joint's the issue. We'll get the joint treated. Well, now we got to train the drift out of them. Like we have to get, like they have compensated, and that's become a habit. Well, now we fix the problem. Well, now we got to get that addressed. Well, let's stop it before we get to that point. Let's catch it early. And like I said, being able to use these biologics, the other thing I love about a biologic too, it doesn't test. Like you don't have to worry about testing issues. There's no FEI forms to fill out, no USEF forms to fill out. We don't have to worry about that. That's one of the other reasons I really like a biologics. Sometimes we got to use them because we're up against testing deadlines. And so, but again, it's healthier if we can catch them sooner.
Yeah.
So ProStride, and like I said, we talked a little bit about that alpha-2 macroglobulin. I'm using more and more of that. Like very seldom I'm doing the straight ProStride into the joint. About every time I'm pulling up that platelet pore, even if I'm doing one joint with it, I'm still going to pull up some of that platelet pore, and I'm going to get that alpha-2 macroglobulin effect. And I think that's an added bonus that's really helping. What I have seen is like if I am up against a deadline, because like I said, we talked about that ProStride, sometimes it can take up to 30 days to really see it doing what it's doing. If I combine some of that platelet pore in there with those alpha-2 macroglobulins, I feel like I can get that response faster.
Yeah.
And again, that's joint therapy according to Dan. I've got zero scientific publication on that, but it's just the feedback I'm getting and just what I'm seeing in practice. I feel like combining that, if I am up against a deadline, still need to use that biologic, putting that alpha-2, putting some of that platelet pore in there, getting the effect of that alpha-2, scavenging those enzymes out of the joint, I feel like I can make progress faster.
Yeah. Yeah.
So, ProStride's really been a game changer. There are times, like I said, in those cushion-oid horses, we got to use something different, but it really has become more and more mainstream, and I'm pretty excited to see that. So,
Yeah. Do you think anything else is going to eventually come down the railroad and then make ProStride obsolete?
I've wondered that because when IRAP hit, we thought, man, we have arrived. Like this is the great, and it was like, so I started using it in 2009, and I probably stopped using it around 2017. So if you look, how many years is that? I
mean,
8 years. 8 years. It was amazing. ProStride, and I remember when ProStride came on the scene before Zoetis had a company named Al Manor had it, and it was very difficult to get people to switch over to it. Because like, why would I do that? IRAP works. Like, what do you mean you're gonna treat with this biologic one time and it's gonna be just as effective? And we're all
people think it's like
very
witchcraft.
skeptical.
I mean, it feels like witchcraft.
It kind of does.
I'm like mixing and matching, and
And we were all really skeptical about it. But then slowly we started switching, and now it's become mainstream. And so, I'm kind of excited. What is next? I never thought I was going to be able to go to my freezer, grab an off-the-shelf product that was an amnion that was highly concentrated in growth factors, and be able to thaw this out and put it into a joint.
Yeah.
Or treat a tendon with it.
How
I didn't see
cool.
it happen. I thought PRP, like we got PRP, and then we had stem cells. I was like, we've arrived. Like
Then boom, here comes Renovo.
And then here comes Renovo.
Sideswipe.
And it's like, holy crap.
Yeah.
I'm getting the same results I was with stem cells. We've got 3 different PRP machines here at the clinic.
Yeah.
I haven't used PRP in 4 or 5 years.
Not to say you can't use PRP.
No.
You can. Soft tissue injuries, you can use PRP.
Yep.
But ProStride, it kind of makes PRP to where you don't necessarily need it as much.
Yeah, and we still use, there's a product called BMAC. I don't know if you've ever done it, but we used to harvest bone marrow. And then we'd run
I
through PRP
personally have not
machines.
done it. I would like to do it, but no, I've seen you do it.
Mm-hmm.
But I have not done bone marrow harvesting.
And we used to harvest bone marrow, and first we were doing it raw, and then we started running it through our PRP machines and harvesting growth factors that way. And they actually, Zoetis actually has a kit where you could actually do a very similar thing using bone marrow and concentrating the bone marrow into something like a PRP and putting it back in. And I have done it. Like I said, usually I'm grabbing Renovo just because I've had great success. But it really is amazing where these biologics are going because, and like I said, will something come out and replace this? Probably. I mean, because we never thought IRAP would be replaced. We never thought PRP would be replaced.
How cool would it be to, as soon as you draw it into the syringe, it's doing this?
I mean, now we're talking like some voodoo magic here. I don't know about that.
I'm telling you, that's what it's going to be.
That sounds like witchcraft,
Well,
which is what we thought.
they didn't think this was possible.
So,
Like, you won't even need the centrifuge machine. You won't even need to, like, haul the big machine with you anywhere.
kind of cool. It would be pretty cool.
I'm just saying. Somebody with a big brain out there is going to come out with it.
Yes.
It's not going to be me, but
Probably not me.
but I guess I'm not sure what we'll talk about in the next episode, but there'll be at least a couple more episodes on joints.
We'll probably get into some of our polyacrylamides next. That's a great topic and kind of a hot one that's going on right now. And ProStride, I did feel like it needed its own episode because it's kind of leading the way. I think a lot of us are reaching for it more and more. People are asking for it, but a lot of times I'm talking to people every day about ProStride. It's a great product. So, to kind of sum things up today is change how you look at things, be open-minded. These biologics have got a lot of benefits above and beyond a steroid. I know it's not what you're used to hearing. Let's grab a steroid and HA. Let's grab a biologic. But be open-minded to it. I think it's great. If you got questions on it, if you want more things answered, send us in. We'll be happy to talk about ProStride again. But everybody, thanks for tuning in today. Thanks for listening. Dr. Zoe, thanks for being here. Casey, thanks for putting this on. Y'all don't see her, but April's behind the camera and behind the old podcast as well, making sure all this
April was
gets
here
done.
bright and early this morning,
So,
helping us out.
Thank you, everybody, for doing that. And like I said, if y'all have got questions, you want things covered, keep sending these topics in. We actually really enjoy going through this. It's a lot of fun for us. So
Yeah, thank
keep
you.
sending them in, and we'll see y'all next time.
Yeah.
Thanks.